Good afternoon. It's Mark Polenkars coming from the Rath Building in downtown Buffalo with another COVID-19 outbreak update. You've got me as well as Kendra from Deaf Access Services who will be providing the American Sign Language. Dr. Burstein is off today, but she's not really off. I've heard her voice at least 3 times on conference calls so far. That's what happens when you are responding to the COVID-19 outbreak. As one of the key essential workers, you may have a day off, but you're really not off. You're constantly dealing with issues. So it's just me. As usual, I want to thank everyone for the work that they're doing to help flatten the curve. We've done a lot of good things in the community, but as I'll show, there's some very worrying concerns that still exist, and it's going to hold back our ability to actually reopen when people would like us to reopen. So with that, I'd like to just remind everybody about the proviso, which is the information that is being provided is as valid as the time it was put into the PowerPoint presentation. It is not the most current with regards to what may have happened in the last half hour or so, but just to put that out there. And we constantly update our COVID-19 website at www.erie.gov/COVID-19, where you can get information on what's happening with regards to all the various aspects of COVID-19. The latest cases, deaths, and hospitalizations, I just want to start right with this. As of 2 p.m. today, there were 3,224 total positive cases out of 15,219 tested. The test that is done, the nasal swab test, has really jumped up in the last week. We've now surpassed most of the other counties in upstate New York with regards to total testing. This does not include antibody tests. 247 persons have died. It's 2 more since yesterday's total. And I just want to once again offer my deepest condolences and sympathies to the family and friends of those individuals. It's a number on the screen, but these were not numbers. These were people. These were mothers and fathers. These were sons and daughters, aunts and uncles, grandparents. And I don't want anybody to ever think that it's just a number, because it's not. 247 people who were alive basically 45 days ago, but unfortunately are now deceased as a result of the COVID-19 outbreak. And the hospitalization report, and this is some news that we have to report that we're not happy about. This just goes to show that people are not following the proper guidelines, because our hospitalization numbers in total have gone to the highest ever with regards to COVID-19. There are 258 individuals who were hospitalized as of April 27th. Of those, 116 were in the ICU ward, and 74 of those had an airway assist, which is generally an intubation and ventilation. And as you can see on this chart, you will note that once we go to the chart, there it is, that you see that curve is now going upwards again. We had the trend of basically staying the same, but the last 3 days in general have seen an uptick of cases to where now, at least on April 27th, the highest recorded number of hospitalizations in Erie County hospitals with regards to COVID-19 cases. The red line is the ICU number, and you can see that's ticked upwards in the last couple days as well. Thankfully, the intubation number has gone down, but that's also a result of hospitals changing the method in which they are providing services to their patients. They're basically trying to use intubation as a last resort. They're not going immediately to that, and we're not surprised to see the intubation numbers go slightly down, but and we should all be discouraged by that number of hospitalizations going up. Here's looking at this on a 2-week rolling average, or actually the last 2 weeks, and we'll get into why that's very important. And you can see that that curve is a little bit more showing that upward trend when you look at it on a 2-week thing for total hospitalizations. We dipped down, we went back up, we dipped down, and now we're going back up at a higher rate than we would have liked to have seen. And you can also tell that ICUs have gone up just slightly to the highest they've been in a few days with regards to the last 2 weeks. And intubations, of course, are going down. I want to show you a chart we have not shown you. I think too many people are saying, hey, I'm young, I don't have to worry about COVID-19. This is the hospitalization data as of April 29th for all 258 individuals who are hospitalized in Erie County hospitals as of that date. And it says April 29th. It really should be April 27th. Sorry that there's a little typo there. It should be hospitalization data, age of patients on April 27th. But there were two children, 2 babies, 2 infants that are in area hospital with COVID-19 under the age of 1, so infants. We see that there's 19 individuals between the ages of 20 and 44. And then you have 34, 45 to 54-year-olds. You have a higher preponderance, of course, of those that are over the age of 55. But this is not just something that people that are old getting sick. Young can get sick as well, such to the point that they need to be hospitalized. And I want people to take that into consideration when they think, I don't have to worry about COVID-19, even if I catch it, I won't get sick. You can get sick. And I really feel for the families of those 2 infants. I don't know how they would have contracted it. It could have contracted at home. We don't know. I don't know enough about or truthfully anything about those cases other than the numbers. But I feel for those families because we know infants have much less of an immune system than most adults do. So we're very worried about those 2 little infants. And I want to offer my best wishes to the families of those 2 children who are in hospital right now with regards to COVID-19. Next slide. This is also not a good slide. Hospital admissions for the 3rd day in a row have increased compared to discharges. So this is admissions of new patients that were known as COVID-19 positive, as well as those that were considered COVID-19 positive but weren't certain until they actually had a positive test. So then they're converted to COVID-19 patients on that day. We had 4 days in a row previously of discharges being greater than admissions, but that is not the case. And you can see for the last day of recorded data, which is April 27th, you have a big blue bar. There were 44 cases that were determined to be admissions on the 27th as compared to 25 cases that are discharged. So we're headed in the wrong direction, folks. And this is only because of community spread. There was a question on social media, how are people catching this? Are they traveling? This is not travel. This is community spread. These are people catching it from other people in the community. So this is happening because people are going around and doing something and catching it from someone else. I don't know if these are essential workers on the front lines. I don't know if these are individuals who are hanging out at the parks, but it's quite apparent that people are not following the guidelines because more people are getting sick. And it's disappointing to see. This is a different chart compared to what you've seen in the past. This is a calculation that we've been keeping track of behind the scenes, which is admissions versus admissions plus discharges. And you wonder, what does this mean, admissions plus discharges? Well, this gives us a daily total of how many people were in all Erie County hospitals in any one day for COVID-19. So you have just the general admissions, those that are admitted and stay throughout the night, versus admitted and discharges, which are those who stay throughout the night, plus those who were discharged during the day. And you can see once again that little tail at the end, which is going up. And that's headed in the wrong direction. We want to see that going down. We want to see, once again, discharges be a much greater difference between the discharges, the reddish line, the cranberry line, so to speak, and the blue line. When they're real closer together, that's not a good sign. That means that there's less of what we're seeing in total. We want to be able to see that line go down and generally see a greater distance between discharges and admissions with discharges. That means more and more people are being discharged on a daily basis versus the overall admittance. So we're keeping track on that. There's a lot of other charts you haven't seen that we're keeping track on, but I wanted to show you this one because it's a little different one, because you see that little tail there that goes up, and that's telling us that we're headed in the wrong direction. Now, a lot of people have been asking, when are we going to open up? Can we open tomorrow? Can we open up May 1st? Well, remember, first off, the governor's pause order is in effect until May 15th. We will not be opening up or doing anything until May 15th. And then yesterday, Governor Cuomo said a region may open up if it has a 14-day decline in the hospitalization rate. We don't. I was showing you those slides for a reason. They basically showed not only have we the highest date on record of hospitalizations on the 27th, but during the 14-day period before, we had, I believe, 7 days in which it went down, 1 day in which it stayed the same, and 6 days in which it went up. And that's not a good sign. So even if we could start the 14-day period, look back and say, could we open tomorrow? We certainly can't, because we now have the highest hospitalizations. While our ICU numbers have stayed fairly constant, we are concerned about the hospitalization number goes up. If our hospitalization number keeps on going up, we're not going to be able to be able to open anytime soon. And I think people need to understand that, because that's going to be one of the keys. Can we control the spread of the coronavirus such that our hospitals don't get inundated? So we couldn't at this point. Now, the governor's got a lot of other things that have to be put in place. He also talked about hospitals must have at least 30% of all hospital beds and ICU beds open. And he said after elective surgeries. Well, we don't have elective surgeries in Erie County right now, but we do have a standard where we've met that standard. We've actually got greater than 30% hospital beds and ICU beds in any one day with regards to the overall amount. Without revealing it per hospital, because I don't think it's fair to do it by hospital, but here's the total amount. So there are 2,793 total hospital beds available in total, I should say, in Erie County. And of those, 1,406 of them were available, or about 50% of all hospital beds were available on April 27th. And then when we look at ICU beds, there are a total of 487 ICU beds in Erie County, and available as of April 27th were 202, or 41%. So if we were to beat the 30% threshold, right now we seem we could do it. That's assuming that we don't have a huge amount of elective surgeries open up right away, and a lot of them go into the ICU beds. So I think we could, as I've said, do a slow increase in elective surgeries. However, the governor said no, we doesn't think we're ready for it. Here's the statistical numbers, at least on the 27th, which shows we had at least 50% of all hospital beds available, and 41% of ICU beds were available. So that means 59% were being used on the 27th. So here's another thing I want to get out, because we've gotten some information from our medical examiner's office that it appears that there's some individuals who may have died in the last couple of weeks from a heart condition or something else like diabetes that could have been treated, should have been treated, but we don't know if people are afraid to go to the hospital. Hospitals are open. Do not stay home in an emergency. They have capacity, as I just showed you. They have 50% of the beds in general are open and 41% of the ICU beds. So they have capacity. If you are a loved one or fearful of going to the hospital for any health reason because of the coronavirus, please know they're safe. Hospitals have designated wards for COVID-19 and non-COVID patients. So if you get in there, you're going in there for a heart condition, or you've got a diabetic issue or something else that's an emergency, you're not going to be slated with the individuals that are COVID-19 patients. So if it is an emergency, please call 911. We will respond. Don't be afraid. Help is available, and the hospitals have available space. We don't want people who may be suffering some heart issue to think, I'm not going to call because I'm afraid of catching COVID-19, and then they die at home of a heart attack. We don't want that. We want people, if it's an emergency situation, to contact us. Please do that. Please call 911. There is hospital capacity. And not to say we want you to go to the hospital if you can avoid it. We don't think, none of us want to have to go to the hospital if we can avoid it, but if it is an emergency situation, go. Call 911. Do not avoid it because of COVID-19 and the fear of catching COVID-19. They've done a very good job in hospitals, I believe, of separating the non-COVID patients from the COVID patients. So please respond appropriately. Some facts and figures, we share this data a lot, mortality data. Which once again shows that a majority of the individuals who've deceased as a result of the COVID-19 outbreak in Erie County are male as compared to females, 129 males, 118 females, and as you can see, 52% of those who deceased are over the age of 80, 22% are 70 to 79. While it definitely has a greater effect on those that are of advanced age, we have had individuals in our community, 5 that have died between the age of 30 and 39. 7 who died between the age of 40 and 49. So I want people to understand that just because you're younger does not necessarily mean that you are immune. You can get sick. You can get very sick to the point you're hospitalized. We have some younger people hospitalized as of the 27th. And when it comes to the deaths, it has had a greater impact on that are older, and males make up 50%. And the next slide is just an example of that in a chart form as compared to the numbers. It's a little easier to see, blue being male, yellow being female. Mortality data based on race and ethnicity. We have seen recently a continual dropping, though it's been much slower lately, of African Americans making up a proportion of the mortality, those who died as a result of COVID-19. At one point, it was up to almost a third of all cases of individuals who had died. It's down to 21.5%. Latinos make up 1.6%. Whites make up about 75%. And then if you go to the next slide, you'll see it as it's based on the population. 80% or 80.6% of the population is white, as compared to 74.9% of the fatalities. 14.6% of the population is African American, as compared to 21.5% of the fatalities. And Latinos are only making up 1.6% of the fatalities, even though they make up roughly 5.7% of the population. We keep track of this because it gives us good information on where we should be focusing some of our responses if there appears to be an outbreak in an African American community or a Latino community. Public health lab and testing criteria, we've been talking about this. Any symptomatic individual will be tested. Sample collection is by appointment only. If you are an individual and you are symptomatic, you have the symptoms of COVID-19, a fever over 100.4 degrees, cough, tightness, shortness of breath, also chills, some other recent symptoms that have been put out there by the CDC as potential symptoms, gastrointestinal issues in conjunction with some of the other things. You can get tested. Call us at the Public Health Lab at 858-2929. If you have a doctor, push option 2. If you do not have a doctor, push option 3. No one will be turned away due to not having a doctor. No one gets turned away due to not having insurance. We want people to understand that we're here to help and test those that may have the COVID-19. Comparison, once again, we've done this comparison the last few weeks with regards to Allegheny County, Pennsylvania, where Pittsburgh is, Cuyahoga County, Ohio. They have seen an uptick in some of those communities. And I'm sorry for my counterparts there that have to deal with increasing death totals. But there is increasing death totals there, but they still don't compare to us. We have 3,224 cases in Erie County as compared to 1,235 in Allegheny County, Pennsylvania, where my counterpart Rich Fitzgerald is. And they have 1,984 cases in Cuyahoga County, where my counterpart Armin Budish is. I've talked to both of them at various times. They were happy about where they were, but they are seeing an uptick. And of course, we have greater deaths. We have 245 deaths compared to 87 in the Pittsburgh area and 109 in the Cleveland area. And I bring that up because both those counties have 300,000 more people, and they're generally more denser. So they're doing something that we're not doing. And I just hope that people understand this is why we've got to continue to follow safe, smart, proper physical distancing guidelines. Be still socially connected to each other, but do it from a social distance, so to speak. Our COVID-19 map, this is as of the number a little earlier, so the tested number is a little off, but the confirmed cases, 3,224. The total deaths, 247. You can see the little chart in the bottom corner, which shows the continued growth of cases. We want to see that kind of dull down, where we're not seeing that continue line. We just want to kind of see it then sort of level off. We're not seeing that leveling yet. And the leveling would tell us that we're having less and less tested positive cases a day. On average, we've been seeing around, of all the people we test, 22% are testing positive. So we know that the contraction rate is about the same throughout the community, and we're hoping that over time that we see that go down. And of course, I hate seeing the number of deaths go up. You can also take a look at this at our COVID map at erie.gov/COVID map and get a breakdown based on zip code and your town. Some of the numbers are sometimes skewed. If an individual resided in a nursing home in a town, they will be identified at that nursing home even if they happen to live for most of their life somewhere else. So someone who was a Buffalo resident for 80 years may have lived in a nursing home in Cheektowaga for 6 months, but if that becomes their permanent residence, that's where the death is recorded. Erie County responds. Earlier I tweeted out we have some great news that I wanted to talk about. Most of the news we talked about so far wasn't so great, but I do want to thank everyone for the great response to the U.S. Census by our Erie County residents during this period. Erie County leads all New York State counties in the census response at 57.8%, and we're followed right up by Niagara County at 57.6%. So big thumbs up to our Erie County residents and Niagara County residents. This is huge. The money that we receive from the federal government is based on the accurate census responses. The congressional representation is based on accurate census responses. So we're doing well, but we still got over 40% of the population that has not responded, so we want people to respond to the census. Buffalo, I'm a City of Buffalo resident, and I did my census, but Buffalo, you need to continue. We're lagging. You're about 41.7%, so come on, Buffalo, pull up that number. It's big for you, too. It's big for the city and the aid that the city gets. I know Mayor Brown's been talking about it. So if you haven't completed the census, do it now. And what's important that you need to understand is it's not a paper form. You can do it online. That's why we have the picture with the woman typing on the computer. You can fill it out online. Doing so will ensure a census taker does not come to your door, which I think a lot of people are worried about. They were like, well, what happens if somebody comes to my door for the census? Do I have to open and talk to them? There's a way to avoid that. Do your census online, and all you got to do is go to my2020census.gov, my2020census.gov, and you can fill it out online. It takes about 10 minutes. It's very important to do it. That will help our community respond in so many different ways to crises in the future, because it depends. Every dollar that we get from the federal government is based on our census numbers. The money we receive for senior activities are based on our census numbers. So please respond to the census. I'm very glad to see our census number as high as it is. It's above the state average, of course. It's above the national average. We're leading all counties in New York State right now. So thank you to everyone else. Big thumbs up for those who responded to the census here in Erie County. Good job as well, Niagara County. We're number 1 and 2 for all the 52 counties in New York State. Let's keep it up. Let's get the highest census response rate we possibly can. It will help us in so many different ways. And with that, I once again want to thank everybody for the continued good work, but there's more we need to do. I'm not happy about those hospitalization numbers. It just goes to show me that we need to do a better job of preventing the spread of the coronavirus, because individuals are catching it and getting sick, and the numbers are going up of the individuals who are being hospitalized. And we're not going to be able to reopen up based on the CDC and the state standards if we keep on seeing our hospitalization numbers going up instead of going down. It's as simple as that. People can ask me all I want about opening up Erie County government. We're going to be looking at those protocols that were announced yesterday by New York State. But if we keep on seeing hospitalization numbers going up, we will not be opening up anytime soon. Simple as that. With that, I'd like to turn it over to the question and answer period right now. So I think we're open now. Let me turn up the volume here so we can hear everybody. If you're not being called upon at that time, I still ask the reporters to mute their phones so we can avoid the feedback that sometimes happens. Let us start at the bottom on my sheet here, which is Mike Baggerman from WBEN.
Hi, Mark. I have a two-part question for you. The first part is Erie County still conducting any contract tracing despite the thousands of cases that we've had? And the second part of that question is, when the pandemic first began in March, we know that there was a confirmed case of coronavirus of someone who went to a Sabres game, but there was no outbreak that occurred because of that. So is there an optimism that as we talk about reopening Erie County, there could still be large-scale events even if someone has the virus?
The question is, the first one was contact tracing. Yes, we have contact tracers. They call all people who test positive from our PCR test, and they are identifying their close contacts. And if they are symptomatic, of course, those individuals are getting tested as well. The Sabres, if I remember correctly, they announced that there was an individual who tested positive that attended the Sabres game. I believe that was a Canadian citizen who attended the Sabres game, which is not surprising because we get a lot of Canadians that come across to attend our Sabres and Bills games. We would not have done the contact tracing with that individual, and if there was, unless the Canadian government and the agency that was doing the contact tracing in Southern Ontario provided us information about individuals who are at risk. We do know that people have caught the coronavirus in pretty much every circumstance you can imagine. In all likelihood, people who've had the coronavirus have unfortunately traveled to pretty much every place you can think of in our community, and I think that's why our numbers continue to go up, not only with regards to positive cases, but more importantly, hospitalizations. Hospitalizations matter more than anything else. People keep on saying how many people have recovered. And we can't give you an exact number because it's self-reporting, but it's pretty easy to determine that anybody who survives coronavirus and is not part of our death listing has recovered from the coronavirus. Our problem is trying to identify every single person at any one time who may have it, and then doing as good a job as possible to ensure that we connect with every individual that they were in contact with, which is not always easy when they say, I was in Wegmans or Tops on a particular day. They could have come in contact with hundreds of individuals. So we are continuing contact tracing, and as you may know, one of the requirements from the state is to have at least 30 contact tracers for every 100,000 individuals in your population. We're not at a point like that. We're going to be ramping up contact tracing, but we've been able to contact trace for all of the individuals who tested positive on the PCR test, and we will be ramping up contact tracing as well based on the guidelines that were announced from New York State yesterday. WBFO, no one's on from WBFO?
No, I'm here, Mark. Mike Desmond.
No, Michael. Very good.
Yes. Question is, when you look at the listed number of deaths, but you look around the country, they're seeing astonishingly high death rates at the same time, but they aren't listed as COVID cases. Do you have any idea how high the death rate, and you must have the March figures by now, is as a hint of people who actually may have died of it, but died at home, died of something else? Any idea how much it's raising the death rate?
I cannot give you that information. It's not. I shouldn't say I can't give it to you. I just don't know it. We'll take that question and go back to our Department of Health and see if there seems to be a greater death rate. I do know that certain things we've seen reductions in. We've seen reductions in auto accident deaths because there are less people on the roads. We've seen reductions with regards to crime. So overall death rate, it's going to be kind of a hit or miss with regards to, there may have been an increase with regards to an individual who died in their home, but we may not know that they died in their home. We know who died that tested positive before their death, and that's what we've been reporting. 247 individuals who deceased as a result of this all had tested positive beforehand. We may not be able to give you an exact answer, but I'll pass that question on to the Department of Health, and hopefully they'll be able to get back with you later.
Because there are some, the figures in New York City, for example, the death rate is wildly up from last year. Same thing for Boston. Boston was up 11% over the 20-year average. It can't all be people who just ate too much chowder or something.
I don't know if it's somebody who ate too much chowder, but we can get you the number and we'll look into that. Buffalo News, Aaron Bessiker.
Yeah, hi, Mark. I just want to follow up on the hospitalization question. You just said the hospitalization figure matters more than anything else. But in terms of the data release, we still, you guys give out the state numbers when you have briefings or when you tweet out the numbers. But we don't get them every day, and your people are telling us to get it from the State Department of Health. And the State Department of Health is telling us, even though they give it to you, that this information is not available. So I guess I'm just wondering, we've got specific numbers for 10 of the last 14 days, but I'm just wondering if there's any way, if this is such a key figure, I don't know, I don't understand why, and I appreciate you guys giving us the state numbers, but there seems to be some hesitancy to provide it because it's not technically the county's numbers. I don't know, but I'm just trying to, emphasize that this is, it's just a little frustrating.
Well, that's why we've provided the chart. Even if we don't have it per day, we do have the chart which shows kind of where we are on the curve. So if we could go back to that chart, if you could go and just find the hospitalization chart for the last 2 weeks at least, and you'll be the one that will put it back up, and it'll give you an idea. No, not there. We're almost getting there. A few more. I think the next one. Oh, next one. Next one. No, going back. One more. Not that. No. No, you're going the wrong way. Gotcha. There we go. So, you can see the dots there. They give us. I know the Buffalo News likes to do its own charts, but we've been revealing this information as based on what we've been told from the Department of Health we could provide, but because it's their data, they have to release the total. It's their data. Spectrum News, Aaron?
Yeah, Mark, we actually had someone call in to us and ask this question. So if people are supposedly social distancing, wearing their masks, how are the cases still spreading? Are we able to trace where the spread is coming from with that contact tracing?
For every individual or every 10 individuals that are staying at home, there's others who are not. And it's not just essential workers. There's a protest that's going to occur outside of the Rath building on Friday. And these individuals think that we've lied about where we are and that we're just doing this to reduce their rights. The old Patrick Henry, give me liberty or give me death. Well, if they contract this, they may get the death. I just want people to understand that I talked to someone earlier today who had just done some business traveling back from Florida and was talking about how Miami is shut down to the point where you could walk down one of the main streets and you won't find a soul on the street. Here, you go down and you go down Transit Road and you think it's normal Transit Road. There's delays. You go to parts of the suburbs, Niagara Falls Boulevard, issues on Sheridan, and it doesn't look any different than an average day. I don't know where people are going. I had to travel to a couple of meetings off-site. I have no idea where people are going, but there are people out there and they're just ignoring it. They think that this is some big hoax, which it's not. Go talk to somebody who lost a loved one. It's not a hoax. Go talk to someone who's been very ill. Joe Eminger, the supervisor of the town of Tonawanda, spoke to local media about his experience dealing with this, and he said it was basically the worst thing he's ever had to deal with, and he relied on prayer to get through it. This is no joke. This is no hoax. And there are people who are not wearing their masks. I have my mask here. Actually, I got a really neat mask from Mary Jean Jakubowski at the library based on the census. This is pretty cool. We want people to do the census, so I'm going to be wearing this one. But a lot of people aren't taking this seriously, and I'm very, very disappointed to the point where it's bothering me when I talk to my colleagues elsewhere, and they're like, you could shoot a cannon down major roads and you won't find anyone. Heck, if you shoot a cannon down major roads here, you'll take out 50 cars. This is serious, this is real, and people are just giving up or saying, I've had enough. Well, you know what? That's going to drive up the hospitalization number. That's going to drive up the death number. And remember when I said you don't want to go over to grandma's house and get grandma sick? And you were talking about contact tracing? I know because it was told by the Department of Health, we have a case in which someone went to their grandparents' house over Easter, infected their grandmother, who died. And then we found out, because we then did contact tracing, and this individual had some symptoms. We tested that person, and they explained, oh, I had headaches, and I had a little cough, but I didn't think it was anything. They were probably the one who infected their grandmother who died. That's what I'm talking about. Now that person has to live with the guilt that what I thought was just a minor headache and cough was actually the coronavirus, COVID-19. I passed it on to my grandmother who died. That's what I'm talking about, and people aren't taking it seriously. We need to take it seriously. Channel 2, are you there? If not, we'll go to Channel 4.
Hey, Mark, I'm here. Can you hear me okay?
I can. Go ahead.
It's Dave McKinley, Mark. Sorry I had to unmute my phone and get to my notes here. Listen, wanted to ask you about one of the other 12 steps the governor outlined, and it coincided with the CDC had to do with how much testing a county can do. Take me a second. That something like 30 out of every 1,000 residents in a county, you have to have the capacity to test 30 or 3% of them. And that would mean in Erie County, we'd have to do about, based on our population, 27,500 a month. In the last week, there have been 5,397, I believe, an average of 771 per day. So at the current rate, though, even over a 31-day month, that would leave us about 3,600 short. I know we're ramping up testing, but my question is, if you can't meet that marker, would you be allowed to subtract those already tested from the population total and then use that number to say that you can test 3% of the population?
Well, first off, there's two different tests. There's the PCR test, which has been the predominant one. That's the nasal swab one. and then there is the antibody test, which some are doing antibody testing locally. The county will be ramping up starting antibody testing. We've just finishing the validation. We're going to announce in the next few days our plan of how we're going to do antibody tests. The goal, we've actually got on order about 100,000 of those. A few thousand have actually come in. So we will be doing that. That is a blood draw test. It is not a fingerprint test. So it has to be done in more of a clinical setting where they actually put the needle, the phlebotomist goes in there, puts the needle in your arm and withdraws the blood. So we actually have 100,000 on order, which is more than what we would need based on I think the status, the number that you talked about. The state is looking at how we're going to respond. We can meet a number of those protocols already, including offering isolation for those who test positive that do not have isolation. Kaleida Health has ramped up its PCR testing, and it's going to do the same with antibody testing. Catholic Health is still waiting for more of the Cephia tests, but they believe they're going to ramp up. ECMC is doing it. A lot of our private labs are doing it. So as you've noted recently, we have jumped up in just the general testing, but once we get the antibody testing up too, we'll be able to do more in total.
It seemed like what the point, one of the 12 points of light, though, concerned the COVID-19 test, not so much the antibody, but the COVID-19. Are you saying that you think that, in the last week, if we're averaging 771 per day, within a couple of weeks we'll be up so that we can meet that 27,500 a month?
Well, if the numbers I'm being told by our partners are correct, yes. It's just a matter of them getting fully online their testing capability where they can do thousands of tests a week. The county would not have the capability of doing thousands of more tests a week just because we don't have sufficient equipment and supplies to do that. We have ramped up our testing. We've gotten more equipment. But we're also relying on our partners like Kaleida Health, Catholic Health, ECMC, as well as the various urgent cares that are out there that are going through Quest Labs, LabCorp, BioReference, and others to do testing. We're not there yet, you are correct, but if things continue as I think they will, and at least I've been told they probably will, I think, yes, we would be able to get there within a couple weeks.
Would you say that last part about being incorrect again? Thank you very much for your answers, Mark.
Okay, thanks, David. Marley, you are live, so everyone's hearing that, David. Marley Tuskies of WIVB TV.
I don't know how to follow that one up, but hi, County Executive. I was wondering because the governor said part of his concern with allowing elective surgeries is that there will be this surge and that the hospitals would not be able to handle that. Even with the hospitalization rates as you see it now, you still believe that our area hospitals at somewhat of a limited basis can handle bringing on elective surgeries?
Yes, if we can go back to the at least a limited basis. I wouldn't think we could do all, but let me go back to the slide. I'll get the folks so they can see it on the screen. They know which one I'm talking about. Here we go, this one here, which hopefully they'll now be able to get on the screen for you. We have 50% bed capacity for all beds, and we have ICU bed capacity of 41%. So you're going the wrong way. Keep going. One more, there we go. So what I think we need to know is, I'm not talking about going and opening for every elective surgery, but there are some elective surgeries that could theoretically be done without causing tremendous harm to our ability to respond in a surge situation. Governor said no. I've had conversations with other people, including Lieutenant Governor, about this. I will continue to share information with them. In the end, it's up to New York State because they control the hospitals. They are the regulators of the hospitals to say whether a hospital can do a elective surgery or not, an elective surgery. So I don't have the power to do that. New York State does, but we'll continue to provide access to New York State on the data, and I will continue to note if we stay where we are, we can do it. Now, if we have a big jump up of ICU beds and so forth, usage for COVID, then of course I think we'd be in a different situation. And the other thing about elective surgeries too is they could be canceled. If we're seeing a run-up that we now are running out of beds, we could always say, okay, now all electives are shut down again. The governor announced yesterday, and he listed again towns or counties where they could do elective surgeries. He did not include Erie. I just wanted to share this data with regards to the number of total beds available. Half of all hospital beds are available. No one's in one as of the 27th. And 41% of all ICU beds are open. I'm hopeful that he would consider it, but we'll continue to provide that information, and the state is the one that makes the determination on it. Ashley Rowe.
Thank you.
WKBW. You're welcome.
Hey, County Executive. Your counterpart in Rochester is calling for hazard pay for frontline county workers. Is that something that you're considering too?
Right now, I'm trying to avoid a plan where I'm going to be laying off and cutting permanently jobs. So we're facing a $200 million potential shortfall. I know that a lot of employees would wish that hazard pay, but right now I'm trying to avoid having to lay off hundreds and hundreds and hundreds of workers. Okay, anybody else that I did not call upon? If not, we'll go back down to Mike Baggerman from WBEN. Do you have any more questions, Michael?
Yes, just as a follow-up to that last question that was asked, you had been touting that the federal government needs to do something to help out Erie County and all local governments. Well, Congress isn't going to be meeting next week because of the rising number of coronavirus cases in Washington. Is that basically a nail in the coffin that Erie County is not getting anything soon from Washington?
Well, if we could probably survive fine the next few weeks, but if we're going into middle of May and June and we're not getting any assistance, then yes, we're going to be implementing a plan which will unfortunately have to shut down services, lay off employees. Do I want to do it? No, but I can't pay for things I don't have cash for, or even if we borrow money under a revenue anticipation note, I got to be able to pay back that note plus a little interest. And if I don't have revenue to pay for it, I can't pay it back, and then we default, and that's even a horrible thing to think about because it would destroy our credit rating. So I am very concerned about what's happening in Washington. I joined a letter with my counterparts in government, John Flynn, the district attorney, Stefan Mihailo, the county controller, Mickey Kearns, the county clerk, Tim Howard, the sheriff, as well as Chairwoman April Baskin and Majority Leader Tim Myers and Minority Leader Joseph Larigo from the legislature, calling on Congress and specifically the Senate to not continue to hold this up. Chuck Schumer has been our strongest advocate, but Mitch McConnell, the senator from Kentucky, is basically telling states and local governments to kind of drop dead. And what he's going to end up doing is resulting in the layoffs of employees that provide key services to our public and the shutting down of services that the public would normally want. And I do not want to get in that situation, but if we're not having the revenues to pay for our expenses, I have no choice but to cut. And it's not something I want to do, but I'm going to balance the budget one way or another. Mike Desmond, are you still there from WBFO? Any other questions?
Yes, in this conversation about elective surgery, there are really two kinds of elective surgery. The one is, with Buffalo General to get a hip replacement, but there are a lot of doctors and clinics and so forth around the area. I mean, obviously, something like plastic surgery. Could we see reopening of some of the non-hospital elective work while you still think about whether or not you want to offer, I don't know, heart surgery in the medical campus?
It's part of the overall conversation. I mean, what you have to take into account is somebody who goes in for minor surgery, and there really is no such thing as a minor surgery, but minor surgery in an outpatient facility, they also have to ensure that there's beds available in case something goes wrong with that surgery and they have to move them to a hospital. It's all part of the conversation that we've had with the state. That's why I've been providing updated information to them. And I've had conversations with the Lieutenant Governor on that. It's going to continue. We'll continue to provide them our thoughts, and we will then hear back from them on what they believe is appropriate for our region. Aaron from the Buffalo News.
Yeah, hi, Mark. Earlier this week, you and Dr. Burstein talked about the UB modeling and an update that you expected to see this week. I'm just wondering, generally speaking, can you talk about how your county government uses that modeling, just in terms of recommendations you make to the community, to hospitals, to residents, and if you employ that information in how you use it when you talk to state officials?
The modeling is very helpful from a standpoint as it gives us a really good idea what's going to happen in the next week to 2 weeks. It's can be a little suspect when you go out further than that. It's just like a weather forecast. If you did a weather forecast for the next 3 days, it's going to be better than a weather forecast for the next 3 weeks, or for that matter, 3 months. So we look at that modeling to determine where we are with regards to hospitalization data. We have received some recent modeling, new modeling from Dr. Peter Winkelstein and his team from UB, and it pretty much has us on a hospitalization rate of where we are for the foreseeable future. Because we've done a good job of stopping the spread in the community, that has prevented us from having that huge spike of hospitalization rate. Because you remember, the idea of flattening the curve is you do a better job of spreading out the coronavirus from its contraction rate, so you're like this instead of like this. And we've avoided that big jump up and down, but we were in that situation now where we're kind of fairly flat according to the modeling, and that's good from a standpoint of, that means that's one of the reasons why I think we could do some elective surgeries, because it looks like we'll be able to control the hospitalization rate. It's not great if we're looking for 14 days of declines in cases and 14 days of declines of hospitalizations, because the modeling doesn't show that. But the modeling is really good for giving us an idea of what's going to happen in the next 2 weeks. And for most of the models that we've seen from Dr. Winkelstein and his team, they've been pretty much spot on for the week to 10 days to at most 2 weeks from when he issues it. They've been pretty accurate with regards to the numbers of hospitalizations. And that's what his modeling primarily looks at, is the amount of people who are contracting in the community and then needing to be hospitalized, including ICU hospitalization. So those numbers have been fairly accurate. The stuff I saw most recently I thought was good, except if you're thinking about seeing a decline in the hospitalizations, because he really doesn't have a decline going out for quite some time. And in fact, actually, over time, instead of seeing it go down, he actually has it kind of just staying level and slightly moving up, if anything. So if we're on that 14-day declination requirement, it's going to be tough to meet that in the near future.
All right, thank you.
You're welcome. Aaron from Spectrum? Any more
Yeah,
questions?
just want to piggyback to the question about funding from Washington. Have you had any direct conversations with Congressman Higgins or Senator Schumer or Gillibrand about what the county needs?
Oh, yes. I certainly have talked to each of them. Congressman Higgins and I were talking just recently. I give him a huge shout out because he's really been a strong advocate for us here. He knows that we cannot provide the services that we need to in the public if we don't get assistance because of the revenue issues that we have in county government. Senator Schumer is the same. Actually, I'm hoping to speak to him in the next few days, especially now that the Washington appears to be on a little leave. So they understand, and they've been our strongest advocates for ensuring that we get the proper funding that we need here. This is not a problem of our New York representatives. I think our New York representatives get it. The president has even talked about doing another round of funding for local governments and state governments. I think he gets it. This is the recalcitrance of Mitch McConnell, who basically runs the Senate. Nothing goes through the Senate unless he wants it to go through. And he's pretty much stopped this further round of funding. So if you know Mitch McConnell, if you're somebody out there who knows Mitch McConnell, and there might be someone here who knows Mitch McConnell, please call him and tell him this is really serious and this is not a joke. We have our finances in county government are really strong, some of the strongest we've ever seen. And this is not an issue of us incapable of providing our services because of ridiculous costs elsewhere. That's not the case. This is a case of a huge crisis that this world has not seen since really 1918 with the influenza pandemic, and the impact it's having on local governments that are the first responders. We are the front lines on the battle with the coronavirus. And we need the assistance to ensure that we can continue to provide that frontline battle. I gave an example earlier today. It would be like sending people to the war on the front lines and them running out of ammunition, bullets and other things for their weapons, and then telling them, well, you know, fight the fight anyway, even if you don't have the bullets and you don't have the tank shells. How could you do that? How could you fight that war if you don't have the ammunition to fight the war? Well, the ammunition to help fight this war is to ensure we have the people out there doing the work. And it's not just the individuals who are in the public health realm, it's the individuals who pick up sanitation. It's our police officers, our fire, our corrections officers, the individuals who have to work with our partners that are essential workers to ensure that they're safe. So we need to have those resources. Dave McKinley, do you have any more questions, David? Hearing none, we'll go up to Marley, News 4 Buffalo. Do you have any more questions, Marley?
Just one quick one. We've been hearing a lot about PPE and the necessary need and all of that, and obviously the ammunition, the proper ammunition that these people need on the front line. How has it been in the past week or so in terms of getting the necessary PPE for area hospitals? Has it been better than what it was previously?
Well, it's definitely better. We've had a number of shipments come in the last week, and we're expecting a couple big shipments this week, which are going to go to healthcare providers, starting out with hospitals and nursing homes. So the supply chain is much better than it was 2 weeks ago, nevertheless a month. We still are working on the N95s, and we have a couple really good things that are going on right now that if go well, and there was an article in the Buffalo News today about how difficult it can be to get the N95 NIOSH masks. But we've been able to get procedural masks. We've been able to get goggles. We're working on face shields. Gloves and gowns are our biggest thing, and we're expecting some fairly decent-sized shipments of those in the next couple of days. So it's much better than it was, and it is continuing to get better as now there's more suppliers out there. And last question to Ashley Rowe from WKBW.
Yeah, thanks, Mark. Staying on the topic of PPE, Buffalo Manufacturing Works has designed a potentially medical-grade procedural mask, yet local manufacturers, for a variety of reasons, including a lack of funding, are not able to ramp up production, and I'm talking about a dozen manufacturers. What's your reaction to that, and what have you discussed with the Lieutenant Governor about how to support these kinds of homegrown efforts by local companies?
Well, we certainly would love to support them. I think they have to get FDA approval for their masks before we could do that. There's a lot of manufacturers out there. We can get the procedural masks, the basic masks, or KN95s. Those are available. They don't provide the protection that the N95 NIOSH masks do. If they have the N95 NIOSH mask capability, then I suggest to them they need to go to the CDC and the FDA and get approval for those masks. Because most governments, most entities, and we provide a lot to the hospitals, they're not going to buy a mask unless they know it can actually protect their workers. No worker is going to put on a mask unless that's in a surgical setting or in a COVID-19 ward if it's not a N95 NIOSH approved mask. If it's just a procedural mask, those are available in fairly large quantities and in varying price points. So if they have the ability to actually build these, I think the thing they need to get is FDA approval and CDC approval to say that their masks are meeting the standard, which will then allow for them to sell to who needs it. And if that's the case, I think they would easily find investors that are willing to support that. But what we're finding out and hearing is a lot of folks are saying, I have this capability, and as was reported earlier today, we thought we were going to get N95 masks about a week ago from a known supplier, and when they finally were delivered, they were not. They were procedural/surgical masks, and we didn't need those. We had lots of them. We rejected it. So that's the biggest thing. If they can actually get approval from NIOSH and the CDC, that's the National Institute of Occupational Safety and Health Hazards, as well as the Food and Drug Administration, that their masks, their PPEs actually meet the standards, then I think that would be a game changer for them.
Just to follow up on that, Mark, I know they are awaiting feedback from the FDA. Would you agree that there's a bit of a chicken and egg issue here, though, because the manufacturers can't pay to do the due diligence and bring their workers in totally retool their facilities as they await this approval and then try to accelerate their own crisis response. But at the same time, there's obviously not going to be a purchase order without that FDA approval. So it seems like everybody's just sort of waiting on each other to get things going.
Yeah, I would imagine that's the case. I could see that being the case. We as a government are not going to put a few $1 million into an organization if we can't get an assurance that what they're doing actually meets the requirements to purchase the masks or to receive masks that then we can put out to the general healthcare community. And we're not even talking about masks for the general public. If they're procedural masks, that would be much less of an issue. But if they are the higher quality surgical grade masks, the ones that would be used in a COVID-19 setting or in a surgery that from a potential COVID-19 patient, they have to be fit tested and they have to meet certain standards. Otherwise, they're not going to be worn by our local healthcare community. Not knowing anything about them, they've not, to my knowledge, I mean, they may have reached out to someone in my office, but I'm not aware of what their proposal is. I can't really talk about the specifics associated with it. I do know from having seen a lot of supposed, this is an N95, and then we get the information about it and the pictures, and it's like, that's not an N95, that's a basic procedural mask. I actually had to recommend to a friend of mine who's a county leader elsewhere, not in Western New York, that they just got ripped off because they were told they were getting N95 masks, and they had a picture of what the N95 mask was, and it was not an N95 mask. And that county prepaid some money, and they got what they ended up getting, which was not N95 masks, but procedural masks. There's a lot of scammers out there, and there's a lot of people who think they actually have what is N95, and it's not. So I could potentially understand the issues they're dealing with, but as a government, I can only invest in what I feel is an appropriate purchase. I'm not going to invest millions into something in the hopes that it gets approved, and if it doesn't, I got stuff that I can't even use. It is a chicken versus the egg.
Appreciate it, Mark. Thank you.
Okay. With that, we will end our presentation today, but I do want to kind of show one more thing. I want to remind everybody. I want to go back to this chart here. If you can go back to the hospitalization data from March 27th to April 27th. I think it's important to remind everybody we're headed in the wrong direction. We are not going in the right direction with regards to hospitalizations. We were going down. We had 4 straight days of declines, and now we've had 3 straight days of increases, including we're now at the highest point with our hospitalizations that we've ever been for COVID-19 patients in Erie County hospitals. And there's a little increase in the ICUs from our low that we were just a few days ago. So people need to pay attention. You need to take this seriously. Individuals are getting sick in our community, and it's not just old people. It's not just people in nursing homes. There are individuals who are dying in their 30s and 40s. I saw that Niagara County and Orleans County just announced a few more deaths. Folks, if we do not send this curve in the other direction, the downward trend, instead of going like this, with that little tail, we need to go like this. And if we're not headed in that direction, there's going to be no opening anytime soon. I know people want to open, saying Mark Poloncarz open this place right now. If our hospitalization numbers are going up, there's going to be no opening. You got to take it seriously. Put your mask on. I've got my mask here. I'm going to put my special mask I got from Mary Jean Jakubowski of the library. Thank you, Mary Jean. The library has been integral in responding to the census. So thank you for the special census mask. If you haven't completed your census, please do it. It has a huge impact on our ability to provide services to the community. I want to thank Kendra from Deaf Access Services. She's been working very hard doing American Sign Language. It's not just today, but many days over, to the point I think her arms are probably getting huge workouts. So thank you, Kendra, for the work that you're doing, and make certain that everyone wears their mask, only goes out when you need to. Stay home, stop the spread, and you will save lives. Be well, everyone.